I'm Dr. Randall Hirota. I'm a cardiologist and a vascular medicine specialist, and my talk today will be on peripheral arterial disease. And thank you very much for allowing me the opportunity to speak to you on a topic today of quite an interest for me in my medical practice, and that is a topic on peripheral arterial disease. It's a disease that affects many people in America. It's a disease that affects the arteries in the legs and causes various problems. And today I'd like to go over a pretty good overview of what peripheral arterial disease is. So my objectives today are listed here. I'd first like to describe to you exactly what peripheral arterial disease is. We call it PAD for short. What are its symptoms? So how do you know you have peripheral arterial disease? Who is at risk of having peripheral arterial disease? How do we diagnose it? What life-threatening problems might be associated with peripheral arterial disease? And finally, how do we treat? Let's start off with a few basics. Arteries. Now, arteries are largely the conduits where blood travels to supply various organs in your body. Arteries exit out of your heart. The heart is the main pumping chamber. It pumps blood, and blood travels through these arteries throughout your body and supplies oxygen and nutrients to the various organs, including muscles, intestines, brain, kidneys, and so forth. But arteries are not just pipes. Okay, they actually have various functions in addition to being a pipeline. They can actually regulate the amount of blood flow to a particular organ. In artery, in cross-section here, you can see various layers. Each layer serves a different function. The middle layer is composed of muscle. And muscle, like any muscle in the body, contracts and relaxes. So when the muscle in the artery contracts, it squeezes down the artery and it makes it more narrow, so less blood will travel through that artery. When that muscle relaxes, the artery dilates, or it opens up, and by doing so, more blood can flow through that artery. So depending on the particular organ, let's say for example, if you eat a meal, if you have lunch today, your stomach and your intestines will detect that food, and it'll tell the body that it needs more blood to digest that food. And so the arteries that supply blood to your intestines will relax, it'll dilate, and more blood will flow into the intestines. The same can be said about any organ, like the muscles. If you exercise, the muscles will send signals to those arteries saying it needs more oxygen for your exercise. Arteries are also porous. So they're not lead pipes. They actually have holes within them so that various nutrients and gases can diffuse through the wall of the artery. It's almost like a contact lens. Various gases and oxygen can pass through the artery. Now muscles, as I described earlier, are like any organ in the body. Okay, they need oxygen and they need nutrients. And those two things are supplied by blood flow. Unhappy muscles are muscles that may not be getting enough oxygen or nutrients. And unhappy muscles will produce pain. They may weaken. And if they're not getting enough of these nutrients or oxygen, they can actually atrophy, which means they will shrivel up, you'll lose muscle mass. Peripheral arteries are simply arteries in the peripheral of the body. So arteries located in the legs or the arms are all considered peripheral arteries. Peripheral arterial disease, or PAD, is a disease process where plaque builds up inside of the arteries. And if they start to build up so severely that they obstruct blood from flowing through the arteries, that's when we have problems. The way peripheral arterial disease develops is that over time, cholesterol particles will enter the arterial wall, and they will sort of set up shop, stick to the wall, migrate inside those layers of the wall, and eventually the plaques will build up larger and larger inflammatory cells are also attracted to plaque. Okay, inflammatory cells are those cells that usually kill bacteria and viruses that enter your body, but they also detect cholesterol plaque, and they don't like plaque in the arteries, so they'll start to migrate into the arteries, and unfortunately, they also cause further damage. They destroy tissue, just like how they destroy bacteria, they can destroy the walls of the artery. So inflammation is there, plaque is growing in size, and if the plaque ruptures because of the tissue destruction, that's when clots, the platelets, will attach to the ruptured plaque and form a clot. And clots are usually the things that causes heart attacks, strokes, and in the periphery, it can cause gangrene. Remember that not all leg pain is due to peripheral arterial disease. Common causes of leg pains include muscle strains, arthritis, especially if the pain is located in the joints, sciatica, which is a condition where the nerves exiting out of the spinal canal in your lower back are pinched. Sciatica is often described as shooting pain, starting from the lower back, shooting straight down into one or both legs. Neuropathy is a condition often seen in diabetics. It affects the very small ends of the nerves way down in the feet and toes. Neuropathy is often described as burning or numbness or pins and needles, tingling sensation that's really quite distal down in the feet and toes. So what exactly is pain that's due to peripheral arterial disease? Well, let me describe that better for you. Pain due to peripheral arterial disease is a muscular type of pain, often described as cramping. The key feature of this type of pain is that it occurs with walking, and it goes away with rest. The medical term for this pain with walking is called claudication. So you may hear that a lot. And this is how I like to kind of explain claudication to my patients. Say in your house, you have certain water pressure. You have a pipeline that's coming off from the street into your household. And if you were to open up one faucet, say you have some amount of blockage in that water main pipeline going into your house. If you were to open up just one faucet, generally that blockage is not severe enough to occlude water from flowing into that faucet with only one faucet. But it's when you try to open up several spigots, faucets, shower heads, you're then going to notice a drop in overall pressure and your faucets will start to dribble. And that's exactly kind of what's happening with peripheral arterial disease and claudication. At rest, your muscles are not using a whole lot of blood. It doesn't need as much oxygen and nutrients. So it might only have one or two of these spigots open. One or two arteries are needed to supply blood to your muscles at rest. But when you exercise, your muscles need more blood. Remember, the arteries need to dilate. You need more blood flow. And with peripheral arterial disease obstructing blood flow higher up, you just don't have enough pressure in the system. And that's when patients will start to develop pain and cramping in the muscles of their legs. The location of the pain sometimes reflects where the blockage is located. So if you had pain with walking down in the calf muscles, well then the blockage is proximal to that. It's upstream, so it could be located in the thighs. Now if you have pain in your buttocks or hips, then that sometimes means the blockage is even further higher up, maybe in the abdomen or pelvis. I mentioned earlier that claudication pain goes away with rest. So that's very classic. Patients with claudication can walk only 50 feet, start to develop pain, stop and rest, and the pain goes away within minutes. Also remember that claudication pain is not a life or limb-threatening condition. Now it does limit lifestyle, it does reduce your quality of life. People are unhappy because they cannot walk. But it doesn't mean that you're going to lose your foot or your toes. The chance of having a serious complication like that is quite low, and we'll talk some more about that. How do you know if you have peripheral arterial disease? Well, first of all, about a quarter of people with peripheral arterial disease have the classic claudication pain, the pain with walking that goes away with rest. And that's only a quarter, unfortunately. Another quarter of people who have peripheral arterial disease have no symptoms at all. And then half of patients with peripheral arterial disease have atypical or unusual type of symptoms. So instead of the cramping pain, they might have more of a fatigue of their legs or a heaviness of their legs when they walk. And because of this phenomenon where a quarter of patients have no symptoms and half of patients have atypical symptoms, this disease is largely under-recognized. And it's underdiagnosed. Okay? Doctors often don't think about it. And because it's under-recognized and underdiagnosed, this disease is undertreated. And that could be a problem. Now, severe complications that I mentioned can occur. They occur rarely, but these two things are bad: ulcers and gangrene. And if these occur, you need an urgent evaluation, and there's a high risk of requiring amputation. Sometimes we can try to rescue and salvage the foot or the toe by performing revascularization, but not all the time. Revascularization meaning opening up arteries, opening up the blockages, fixing them. Peripheral arterial disease is a common problem. If we were to take a random sampling of people age 70 or older, about 29%, a third of them will have peripheral arterial disease. And PAD is also a growing problem. Right now we estimate that about 8 to 12 million people in the United States have peripheral arterial disease. And by the year 2050, that number is going to reach about 19 million. It's quite a lot. And it's as prevalent as many other common diseases. So it's in fact more common than heart disease, more common than breast cancer and stroke, and it's almost as common as colon cancer. Now, peripheral arterial disease shares risk factors with other diseases like heart disease and stroke. It's because the same process of cholesterol plaque building up in the arteries of the legs are happening in the arteries of the heart and the arteries of the neck and brain. Many people with heart disease have peripheral arterial disease. Many people with stroke have peripheral arterial disease. They're all somewhat linked, okay? And if you have peripheral arterial disease, your risk of having a stroke in your lifetime is increased 2 to 3-fold. Your risk of having a heart attack, if you have peripheral arterial disease, is increased 6 to 7-fold. So again, this summarizes what I said earlier, in that if you have peripheral arterial disease, your 5-year risk of having worsening claudication, worsening symptoms or pain is about 10 to 20%. Your risk of having critical limb ischemia, those ulcers or gangrene, is only about 1 to 2%. And so that's why I say I'm not as concerned about those serious complications, because they're very rare. They don't occur very often. The main problem with peripheral arterial disease is the higher risk of developing heart attacks and strokes. That's the major concern. And then if you have PAD, your risk of dying is higher. And it's higher largely because of heart attacks and strokes. So how do you know if you're at risk of having peripheral arterial disease? The two major risk factors are diabetes and smoking. Okay. In addition, these are all those risk factors I'm sure you've heard of before: high blood pressure, high cholesterol, prior heart disease or stroke, physical inactivity. It's the same risk factors of having a heart attack. It's the same risk factors of having a stroke. Now, it's relatively easy to test for PAD. I perform this a lot in the office. It's called the ankle brachial index, or ABI. for short. It's a simple measurement of the arm pressure and the ankle pressure. Okay, and it's a comparison between those two pressures. Now, normally, pressure within a closed system like the body is equal everywhere. So the pressure in the arm should be the same as the pressure in the ankles. But if you have a blockage in the arteries in the legs, then the pressure in the ankle is going to be lower because of that blockage compared to the pressure in the arm. So it's a simple ratio. Ankle pressure over arm pressure. Normal being 1. Abnormal being anything less than 0.9. Claudication often occurs when this ABI is less than 0.8. And severe pain that occurs with rest often occurs when this ABI is less than 0.5. So the lower the pressure in the ankle, usually the worse the disease is. Now the ABI not only is able to screen and diagnose for PAD, it can actually tell you some prognosis. If the ABI gets, the lower this ABI value, the higher your risk of having either death, heart attacks, or strokes. Now, once we diagnose peripheral arterial disease, oftentimes we order additional testing just to determine really how bad, how severe your disease is, where exactly is your disease located. And we can do tests such as ultrasound, using sound waves to give us somewhat of a fuzzy image of your arteries. And in this case, this is the artery, this black stripe. This is where blood flows. Here is a branch coming off of that artery. And here is a fuzzy plaque that's starting to obstruct blood flow in this artery. CAT scans and MRIs are also very useful. And over the past 5 to 10 years, the technology has really improved so that we can get three-dimensional images now of the body, including the arteries. And it may be difficult to see in the back, but in this case, we have one leg, the other leg. This is the knee joint for both legs. And here's an artery coming down this leg, an artery coming down this leg. This one is nice and pristine, nice and smooth without blockages. But on this side, there's a single, very tight blockage right at the knee joint. And then finally, we could do a procedure called a catheterization, where we insert a catheter into one of your arteries and we inject contrast right into the artery and look at it under an X-ray camera system. In this patient, we have two arteries, one coming down this leg, the knee joint is right here, and a second artery coming down the opposite leg. Now, on this side, there's a tight blockage right here, a pinching of that artery. And on this side, there's a complete occlusion of that artery. It's supposed to travel down just like this side, but it stops right here. Okay, and that's a bad sign. Now, one thing that's interesting to see on this image is that after the blockage, this patient started to grow new blood vessels. Okay, it's blood vessels that sprout from the existing arteries to try to supply blood to the tissues and muscles that follow where the blockage is. Okay. So the body has some capacity to grow new blood vessels. In the next few slides, I'll talk about how we can try to stimulate that body to grow more blood vessels. Treatment of peripheral arterial disease is focused on two areas. One, really reduce the risk of having a heart attack and stroke. Remember, that's my main concern as a doctor. I want to keep my patients alive. I want them to keep them free of having a heart attack and stroke, because those two conditions can be debilitating. Patients often come to me instead because they have pain in their legs. It hurts, doctor, because I really want to walk. I really want to exercise. I want to enjoy myself, and I can't walk because of this pain. So please help me. Now, when I see them, I have to think of both of these problems and address both of these problems. So to help with reducing a patient's risk of heart attacks and strokes, we need to treat those risk factors that I mentioned earlier. We need to treat the high blood pressure, keep their cholesterol under control, make sure their diabetes is being well managed. And sometimes certain blood thinners like aspirin or other prescription blood thinners may be helpful in reducing the risk of heart attacks and strokes. Now, aspirin and other blood thinners can also increase the risk of bleeding, so if you are interested in starting aspirin, you should talk with your doctor about that first. Now, there are two medications that can be prescribed which may help in the treatment of claudication. May help people walk farther with less pain. The first medication here, pentoxifylline, the trade name is Trental, needs to be taken 3 times a day. It doesn't carry a whole lot of side effects, but it also doesn't work very well. The vast majority of patients who try pentoxifylline won't notice any benefit whatsoever. The second medication, cilostazol or Pletol, is a medication that you only need to take twice a day, but it does help people walk farther with less pain. But it also comes with several bad side effects. A lot of people who take cilostazol will have headaches. In fact, 40% of people taking cilostazol develop headaches. A lot of people develop stomach upset. And finally, it can't be used if you have certain heart conditions, like heart failure. So it's not great. We don't have great medications to help with claudication. Two important treatments that will address both heart attacks and strokes and claudication is smoking cessation and obtaining regular walking exercises. The beauty of these two things is that it has no side effects. You don't have to worry about headaches, stomach upset, heart failure, and it addresses both problems of peripheral arterial disease. Almost every day, almost every patient I see, I talk about diet and exercise. And I've probably heard 100 of different excuses about why someone can't exercise. Doc, I think I get enough exercise just babysitting my grandchildren. But I think it really boils down to 2 issues. One is that patients don't feel that exercise will benefit them. They don't believe that it worked. And I want to kind of demystify that problem. Well, and secondly, they believe that walking isn't fun. Okay, they perceive it as something that's more of a chore. And so I oftentimes have to talk with my patients for a long time to really motivate them. Now, the benefits of walking are that it reduces stress. I already mentioned that it controls blood pressure, blood sugar, cholesterol, and weight. It improves muscle tone. It builds up bulk, muscle bulk. It gets you stronger and more fit. It lowers the chance of heart attacks and strokes. And it also gives you the peace of mind that you are taking some control of your body, of your life. You're not letting peripheral arterial disease or heart disease take over you. You're not succumbing to medications, to popping pills all the time. You have an impact in your health. Now remember, a lot of people don't believe walking works. Well, let me just say that research has been done on this issue. People have studied whether or not walking helps. And I can say that with patients with peripheral arterial disease, by starting a regular walking exercise program for 3 months, people will increase their walking time by 5 minutes. They will be able to walk farther. They will be able to walk without pain for another 90 yards, almost the length of a football field. And then they can walk. They can push themselves even through the pain of claudication for an additional 124 yards. So walking works, and it's better than those 2 prescription medications that I just mentioned. The Cilostazol, the one with the headaches and such, that will only get you probably an additional 20-25 yards of pain-free walking. But an exercise program, a walking exercise program, is a whole lot better, a whole lot more efficacious. How do I make walking more fun? How do you make walking more fun? Well, you know, it's not fun sometimes just walking by yourself, I have to say, or walking on a treadmill, you know, in your house. That's not fun. But maybe walking with a friend. Your friend could be 4-legged. That's often fun, and you meet a lot of people, I've noticed, walking a dog. You know, everybody comes up to you, say how cute your dog is, and it can be quite a social event. So you need to find ways to make walking fun. But here are some suggestions that you may consider. Walking with a friend, listening to music, walk somewhere where it's more interesting than just a treadmill in your bedroom. Walk in the park, you know, or walk along the beach. Or maybe at a mall and do some window shopping while you're exercising. But try to make it more fun, okay? And really what helps, I think, the most is being able to walk with friends or in a group. Now, if you have peripheral arterial disease and you want to walk, make sure you have good cushioned athletic shoes. Okay? The last thing I want to have happen is, you know, having sores or blisters, especially if you have bad circulation, because I don't want you to get ulcers. Examine your feet daily, especially if you have diabetes, because remember, diabetics have that neuropathy problem where they sometimes have numbness and they can't feel if an ulcer or a blister is developing. Track your progress, okay? So get a little piece of paper and log every day what you've done, how far you've walked, or how long, the time that you've walked. And by doing so, it kind of reinforces yourself. You can see how much you've improved. And I guarantee you, if you stick with it for 3 months, you'll see that improvement. And you can see it objectively on a piece of paper. You know, you can see, oh, I started off really bad. I could only walk for 10 minutes this first day. But now I can walk for a good 30 minutes, good 45 minutes. And then finally, when you meet that goal, reward yourself. You know, buy a new hat for your walking, or a new pair of shoes, or walk to the movie theater and enjoy a movie after your exercise. The walking has to be done as a program. You know, it's not simple enough to get your walking while babysitting your grandchildren, or walking from your house to your car and your car back to your house. That's not enough walking, and it's interrupted walking. Instead, what you need is a program where you walk for a prolonged period of time, okay? And these are several steps which I would recommend you consider. So step 1 is to do a warm-up for about 2 or 3 minutes, just a very slow pace. You walk. And after you've warmed up your muscles, then you should do some stretching for another 2 to 3 minutes. And 2 stretches here I've listed are quite important. One is the wall push, and the wall push consists of bracing yourself against the wall, just like this, putting 1 foot forward and 1 foot back, and really stretching out, you know, your hamstrings here on the foot that's towards the back. And you repeat this on the other side. So you're really just stretching out all this area. The leg curl, you again lean against the wall for balance, and you pull up on your ankle right here, and you're stretching out all this front area of your thigh, your quadriceps, okay? Just pull it back. And the same thing on the other leg. Just balance yourself so you don't fall. Pull up on your ankle and really stretch out that muscle. So you're stretching it all out, and that will help. And then the main portion of your walk is here, step 3, through step 5, actually. You start walking at a pace that will eventually cause you some discomfort in your legs. You don't want your walking exercise to be so slow that you're not going to derive any benefit. It's too easy for your muscles. You want one where your muscles are a little bit under some strain. And that's important because that strain and the pain that you feel is the stimulus to grow new blood vessels. Okay. So remember, we saw the picture of the artery that was blocked and all those tiny blood vessels that are trying to supply more blood to the leg. Exercise is the way to stimulate that growth. When you meet that goal, reward yourself. Buy a new hat for your walking, or a new pair of shoes, or walk to the movie theater and enjoy a movie after your exercise. The walking has to be done as a program. It's not simple enough to get your walking while babysitting your grandchildren, or walking from your house to your car and your car back to your house. That's not enough walking, and it's interrupted walking. Instead, what you need is a program where you walk for a prolonged period of time. Okay? And these are several steps which I would recommend you consider. So step one is to do a warm-up for about 2 or 3 minutes, just a very slow pace. You walk. And after you've warmed up your muscles, then you should do some stretching for another 2 to 3 minutes. And 2 stretches here I've listed are quite important. One is the wall push, and the wall push consists of bracing yourself against the wall, just like this, putting 1 foot forward and 1 foot back, and really stretching out, your hamstrings here on the foot that's towards the back. And you repeat this on the other side. So you're really just stretching out all this area. The leg curl, you again lean against the wall for balance, and you pull up on your ankle right here, and you're stretching out all this front area of your thigh, your quadriceps. Okay? You just pull it back. And the same thing on the other leg. Just balance yourself so you don't fall. Pull up on your ankle and really stretch out that muscle. So you're stretching it all out, and that will help. And then the main portion of your walk is here, step 3 through step 5, actually. You start walking at a pace that will eventually cause you some discomfort in your legs. You don't want your walking exercise to be so slow that you're not going to derive any benefit. It's too easy for your muscles. You want one where your muscles are a little bit under some strain. And that's important because that strain and the pain that you feel is the stimulus to grow new blood vessels. Okay. So remember, we saw the picture of the artery that was blocked and all those tiny blood vessels that are trying to supply more blood to the leg. Exercise is the way to stimulate that growth. The walking has to be done as a program. It's not simple enough to get your walking while babysitting your grandchildren, or walking from your house to your car and your car back to your house. That's not enough walking, and it's interrupted walking. Instead, what you need is a program where you walk for a prolonged period of time. Okay? And these are several steps which I would recommend you consider. So step 1 is to do a warm-up for about 2 or 3 minutes, just a very slow pace. You walk. And after you've warmed up your muscles, then you should do some stretching for another 2 to 3 minutes. And 2 stretches here I've listed are quite important. One is the wall push, and the wall push consists of bracing yourself against the wall, just like this, putting 1 foot forward and 1 foot back, and really stretching out, your hamstrings here on the foot that's towards the back. And you repeat this on the other side. So you're really just stretching out all this area. The leg curl, you again lean against the wall for balance, and you pull up on your ankle right here, and you're stretching out all this front area of your thigh, your quadriceps. Okay? You just pull it back. And the same thing on the other leg. Just balance yourself so you don't fall. Pull up on your ankle and really stretch out that muscle. So you're stretching it all out, and that will help. And then the main portion of your walk is here, step 3 through step 5, actually. You start walking at a pace that will eventually cause you some discomfort in your legs. You know, you don't want your walking exercise to be so slow that you're not going to derive any benefit. You know, it's too easy for your muscles. You want one where your muscles are a little bit under some strain. And that's important because that strain and the pain that you feel is the stimulus to grow new blood vessels. Okay. So remember, we saw the picture of the artery that was blocked and all those tiny blood vessels that are trying to supply more blood to the leg. Exercise is the way to stimulate that growth. So you gotta pace yourself at a rate where you will stimulate those blood vessel growth. And you need to be able to feel that strain in about 5 minutes. Now, once it gets bad, once you start to really feel that pain, then stop. You're going to stop and rest. Either just stand up until it goes away or sit down. Doesn't really matter. And once it goes away, resume your walking. So it's going to be a stop and go process. You walk for 5 minutes, you get the pain, you stop for a minute, goes away, you walk for another 5 minutes, stop, walk, stop. And in total, you'd like to reach a session of about 45 to 50 minutes. When you first start off your walking program, you're not going to probably reach 45, 50 minutes. You may only reach 15 minutes until you get quite tired. But that's okay, because over time, you're going to start to build up your endurance and your strength, and you're going to notice you're going to be able to walk longer. Great. Now, after you finish your exercise session, you should have a cooling down period. Just like when you first started warming up, you just walk at a very slow pace. You know, cool down your muscles, and then perform those stretching exercises once again. And then finally, the last step is really to congratulate yourself. You know, give yourself a nice good hug for the great workout that you just completed. Now, if medications, exercise, and diet are not enough, you know, someone like myself, a vascular specialist like myself, can perform additional advanced treatments to try to break open plaque and blockages and restore blood flow to the legs. Angioplasty and stents are similar to the procedures we perform for heart disease, blockages in the arteries of the heart. We do it the same way. Bypass surgery is just like bypass surgery of the heart arteries, except we're bypassing blockages in the leg arteries. Here we have a bypass graft, which is sometimes veins, but other times it's prosthetic material that's made out of Gore-Tex. And we plug into the artery upstream from the blockage and also downstream from the blockage. So now you have a conduit, a bypass where blood will flow around the blockage. There's a procedure called end arterectomy, what we do often for the carotid arteries, but it can also be done in the leg arteries, especially at the groin site, where a surgeon will splice open, cut open the artery and kind of scoop out the plaque and all the calcium that might be there and sew it up once again. But these procedures are only done for really bad disease, because even despite a successful procedure, right after the procedure your arteries are open, the chance of those arteries closing up again, or those bypass grafts closing up again, is quite high, in fact. Angioplasty and stents, only about a third of patients will still have open arteries after a 5-year period. And bypass surgery and endarterectomy are really not any better. You know, bypass grafts can close up. About 50% of them will be closed in a 5-year period as well. So that's why I wanted to stress today the importance of medical therapies, controlling your risk factors, blood pressure, cholesterol, diabetes, not smoking, and then finally exercise and diet, because those are the proven ways of treating this condition. So in summary, PAD is common, it's underdiagnosed, and it's undertreated. It's often asymptomatic, has atypical or unusual symptoms. The most important problem with having peripheral arterial disease is the higher risk of having heart attacks and strokes. Less frequently do people get ulcers and gangrene from this condition. Treatment should focus on risk factor modification, blood pressure, cholesterol, diabetes, smoking, exercise. And walking exercise is the proven way to lower heart attacks and strokes, and it's proven to improve claudication pain. And it's way better than any prescription medication. So thank you very much again for your attention.